He has been a great mentor throughout these past couple of years, and he has taught me how to handle different animals, how to treat them, and if I ever have questions, he's right there.
When season 24 of The Incredible Doctor Pol opened on January 6, 2024, something felt different almost immediately. The familiar narrator was gone, the production style had changed, and a new veterinarian, Dr. Olivia Stubbins-Belson, appeared prominently. But for longtime viewers, one absence mattered most: Dr. Nicole Arcy. On the show's fan forum, viewers were asking bluntly, "Where is Dr. Nicole?" And now, the internet is abuzz with rumors of how Dr. Nicole Arcy has broken her silence. But to understand the shocking reason she left the show, we need to take a look at it all from the very beginning. The veterinarian who became a television star. Nicole Arcy had not entered the Pol universe as a television personality looking for fame. She had trained for veterinary medicine. She earned her bachelor's degree in zoology from Michigan State University before completing both a Doctor of Veterinary Medicine and a Master of Public Health at the University of Missouri in 2018. That same year, she joined Pol Veterinary Services in Central Michigan. Her professional profile describes her starting there in June 2018, and the show's own episode description later introduced her as a University of Missouri graduate returning to her home state to learn from the professionals at Pol Vet and treat animals of all kinds. And that phrase, animals of all kinds, was important. Pol Veterinary Services was not a conventional small animal clinic. It was a mixed practice where a veterinarian could move from dogs and cats to horses, cattle, and other farm animals, sometimes within the same day. That diversity was part of what attracted Nicole. In an interview for the Dr. Pol Presents series in 2020, she spoke about Jan Pol not as a television celebrity, but as a great mentor who taught her how to handle and treat different animals, adding that when she had questions, he was there. Then the cameras arrived. On February 23, 2019, viewers officially met Nicole in Season 14, Episode 7 of Mice and Macaws. The episode description introduced her as the new doctor at Pol Veterinary Services, a Dearborn, Michigan native and University of Missouri graduate who had returned to her home state to learn from the team and treat animals ranging from farm cases to exotic patients. Just a few episodes later, the series described her as the newest addition to the Pol team, helping with farm calls and clinic cases. The transition was therefore gradual but unmistakable. The young veterinarian who had joined the clinic in 2018 was becoming a recognizable television presence by 2019. Over the following years, Nicole became one of the show's most visible younger veterinarians. Her cases ranged widely, which made her particularly useful to a program built around the unpredictability of rural veterinary medicine. By season 24, she was still handling demanding cases on camera. On February 3, 2024, an episode titled The Plot Chickens featured Nicole performing an emergency C-section on an older cat, while another season 24 episode showed her treating an injured service dog. By the time she entered Pol Veterinary Services, Jan Pol's name was already bigger than the clinic itself, and the practice had become a subject of professional debate. Nicole wasn't standing outside that world and commenting on it. She was working inside it, learning from Pol, treating animals under the Pol Veterinary Services banner, and eventually becoming part of his television franchise. This meant visibility on an international level, but it also meant that every controversy would get just as much amplified, and the show certainly had its fair share. Behind the friendly television image. The friendly image of the Incredible Dr. Pol began to look very different once regulators started examining what viewers were actually seeing. One of the first major cases centered on an 8-year-old pregnant German short-haired pointer named Mocha in Michigan. Beginning on April 3, 2010, Mocha's owners repeatedly contacted Pol Veterinary Services because she had failed to deliver her puppies. On April 9th, after the dog developed a brownish-green discharge, she was examined and sent home. 3 days later, an ultrasound reportedly showed no fetal movement. Jan Pol believed he saw movement and thought the due date might have been wrong, while the owners wanted a C-section. They eventually took Mocha elsewhere, where a second ultrasound found no movement, and a C-section revealed 10 dead puppies. They had been dead for at least 3 or 4 days. This led to a formal professional disciplinary proceeding before Michigan's veterinary regulators. In 2012, the Michigan Board of Veterinary Medicine placed Pol on probation for up to 1 year, fined him $500, and required continuing education involving documentation and record-keeping, small animal reproduction, and ultrasound techniques and interpretation. Pol maintained that he had not been negligent or incompetent. He later told the VIN news service that, in his view, the clinic's mistake was failing to document all conversations with Mocha's owners, and that he accepted the disciplinary action in an effort to bring the complaint to an end. Then something extraordinary happened. A Kentucky veterinarian named Eden Myers watched an episode of The Incredible Doctor Pol, featuring a Boston Terrier called Mr. Pigglesworth, who had been struck by a car. The dog had an eye displaced from its socket, severe mouth lacerations, and a fractured pelvis. Pol agreed to treat him within his owner's $300 budget, removing the damaged eye, repairing the mouth injuries, and deciding that the pelvis could heal without surgery. Mr. Pigglesworth survived, but Myers believed what she saw on television demonstrated unacceptable veterinary practice and filed a complaint with Michigan regulators. The allegations were strikingly specific. The complaint said Pol had failed to wear a cap, mask, and gown during the major surgery, that his assistant had not worn gloves or the same protective clothing, that no intravenous therapy had been provided, and that the dog had not received a warming pad or blanket afterward. Regulators ultimately imposed a $500 fine and 1 year of probation. But there was a problem. The legal case was built around a television episode, and the person who initiated the complaint had never personally witnessed the treatment. In 2016, the Michigan Court of Appeals dismantled that disciplinary decision. In a unanimous 3-judge ruling, the court reversed the probation, fine, and continuing education requirements and ordered the complaint dismissed. The judges called it the curious case of Mr. Pigglesworth. Their reasoning went beyond whether Pol had worn the correct surgical clothing. The court found that the evidence did not establish a sufficiently clear standard of care that Pol had violated, and that the administrative decision had gone beyond the allegations actually contained in the complaint. Most remarkably, the court noted that the Kentucky veterinarian who initiated the complaint had seen only a few minutes of the case on a television episode that was heavily edited and partially reenacted. The court also emphasized something the television audience already knew, but regulators had to confront. The dog survived. Mr. Pigglesworth went home the following day, and the appellate opinion pointed out that his owners were satisfied with Pol's treatment. The judges even ended their discussion by noting that the dog presumably continued to bring great joy to his owners and terror to the local squirrels. Outside the courtroom, however, the fight was becoming even louder. Eden Myers began pushing publicly for the Incredible Doctor Pol to be canceled, arguing that the program promoted substandard veterinary medicine. In June 2013, Myers announced that Michigan regulators had opened a formal investigation following a complaint she had filed over an episode of the show. Meanwhile, Nat Geo Wild defended Pol, saying he had practiced what it called a common-sense approach to veterinary medicine for more than 40 years and had treated thousands of animals. The network argued that critics were rushing to judgment without understanding the circumstances of his rural practice or watching complete episodes. But the troubles for the show and its stars did not end here. The case that came after the victory. Once again, a viewer was watching The Incredible Doctor Pol when something on screen raised enough concern to trigger a formal complaint. This time, the procedure was an ovariohysterectomy, essentially a spay operation performed on a dog. The viewer objected to what appeared on the episode, and the complaint eventually reached Michigan regulators. The allegations were that Pol had allegedly failed to intubate the dog or place an intravenous catheter, failed to use electronic monitoring, failed to ask for assistance locating the uterus, and failed to wear a surgical cap, mask, and gown. Then the case widened. After the original complaint was filed, regulators received another complaint, this time from the owners of a horse whose left hip had suffered a laceration. They alleged that Pol had failed to wear surgical gloves and had failed to reduce or clip the hair surrounding the wound before treating it. Michigan's Attorney General had to get involved, A superseding complaint was filed, and Pol requested a formal hearing and dismissal. The administrative proceeding ultimately stretched across several days and generated a 53-page proposal for decision containing testimony from multiple veterinary experts, exhibits, factual findings, and credibility determinations. And then came the first major surprise. The administrative law judge did not conclude that Pol had been negligent. After hearing the experts, the judge found the testimony of veterinarians James Havenga and Robert Van Wessem more credible than that of veterinarians Joseph Klein and Lisa Zeppa. The judge concluded that the state had failed to prove by a preponderance of the evidence that Pol had been negligent or incompetent in his treatment of either the dog or the horse. The recommendation was therefore straightforward: no sanctions. But Michigan's disciplinary subcommittee disagreed. It adopted the administrative law judge's findings only in part and rejected the conclusion that there was insufficient evidence of negligence. The subcommittee determined that Pol had violated Michigan's public health code by failing to intubate the dog during the ovariohysterectomy, failing to wear a surgical mask and gown during the procedure, and failing to clip the hair around the horse's wound before suturing it. The board placed Pol on professional probation for a minimum of 1 day and a maximum of 1 year, and required continuing education in small animal surgical preparation and monitoring, and small and large animal aseptic technique. One of the state's experts, Dr. Joseph Klein, testified that an unconscious animal's airway should be protected and described intubation during the surgery as an established standard of care. He connected that position to veterinary surgery lectures, textbooks, monographs, and peer-reviewed scientific literature. On surgical clothing, he explained the purpose of aseptic precautions in remarkably direct terms. Covering the head, mouth, hands, and clothing was intended to prevent contamination of the operative field. Pol fought back by pointing to the earlier case. His argument was essentially the Court of Appeals had already rejected a disciplinary action involving surgical attire, so regulators should not be allowed to punish him again over similar conduct. But the court rejected that argument. Then, on December 19, 2019, the Michigan Court of Appeals concluded that the expert testimony was sufficient to establish an applicable standard of care and that the disciplinary subcommittee's findings were supported by competent, material, and substantial evidence. The court therefore affirmed the professional probation. And that brings Nicole Arcy back into the picture at exactly the right moment. She had joined Pol Veterinary Services in 2018 and entered the television cast in 2019, meaning she was working within the organization while this second disciplinary case was unfolding and when the appellate court ultimately upheld the sanctions. But there is an important boundary the evidence does not cross. The 2019 court decision does not accuse Nicole, discipline Nicole, or identify her as responsible for any of the veterinary conduct under investigation. The proceedings were against Jan Pol, DVM. She was inside the clinic during one of the most scrutinized periods in its history, while the cameras were turning everyday veterinary procedures into nationally broadcast evidence. Yet so far, she never commented on these court proceedings. But then she was gone. So why did she leave, if not because of the controversies? Nicole in the middle. Nicole spent roughly 6 years in Dr. Pol's clinic, and through it all, she showed immense respect toward Pol. In an interview profile, she described him as a mentor who taught her how to handle and treat different animals and said that he was available when she had questions. Her attraction to Pol Veterinary Services was also closely tied to the breadth of the practice. She wanted experience with small animals, large animals, and exotics rather than being confined to one specialty. So when the regulatory scrutiny intensified around the clinic, Nicole was working inside an environment she had originally chosen precisely because of what it could teach her. And despite all the controversies, there was a genuine counter-argument. Pol's supporters emphasized that his practice was based in rural central Michigan and served clients who sometimes had limited financial resources. Online veterinary discussions repeatedly raised the possibility that what looked outdated in a modern small animal hospital could reflect a different model of rural mixed animal practice, where cost, accessibility, and practicality mattered. Some viewers even argued that Pol's ability to treat farm animals quickly and inexpensively was precisely why his clients valued him. Online viewers have also scrutinized some of Nicole's cases and accused her of making diagnostic or treatment mistakes. One February 2024 Reddit discussion, for example, pointed to a season 20 case involving a cow that Nicole reportedly diagnosed with an abscess before Dr. Brenda later returned and found severely rotting teeth associated with a serious infection. Another discussion focused on a difficult calving in which Nicole attempted a phytotomy, was unable to extract the dead calf, and ultimately recommended a C-section that the owners declined. In that second case, viewers themselves disagreed over whether Nicole should have called another veterinarian or whether assistance may simply have been left out of the television edit. But these are viewer allegations, not disciplinary findings. In fact, veterinary professionals discussing the program have often made exactly this broader distinction. Television shows viewers selected cases and edited footage, meaning the audience does not necessarily see the entire clinical record, every diagnostic consideration, or everything that happened before and after the camera was running. That leaves us with a remarkably clean dividing line. John Pol has a documented regulatory history. Nicole Arcy does not have an equivalent disciplinary record, and that makes the next development in Nicole's life even more important. Motherhood, the missing episodes, and the new clinic. By late 2023, Nicole had spent nearly 6 years at Pol Veterinary Services. Then her personal life changed. She became a mother to a son named Noah, and her transition away from Pol happened almost immediately afterward. She moved to Clare Animal Hospital in February 2024, meaning that the woman viewers had come to know as a veterinarian constantly moving between farm calls, emergency procedures, and television cameras was entering an entirely different phase of her life. Then, almost perfectly timed to create confusion, Season 24 arrived. On January 7, 2024, viewers noticed that The Incredible Doctor Pol suddenly looked different. The narration and background music had changed. The production had a more stripped-down documentary feel, and Nicole was missing from the opening episode. The fan reaction was immediate. Some noticed that Dr. Olivia Stubbins-Belson appeared much more prominently and wondered whether Nicole had left altogether. But then, the mystery became even stranger. Nicole appeared in the following episode, but you see, fans were watching episodes that had been produced at different points in time. Television creates an illusion of simultaneity. What viewers saw in January 2024 was not necessarily what was happening at Pol Veterinary Services that same week. Nicole had already moved into a new professional chapter by February 19, 2024, when Clare Animal Hospital officially welcomed her to its team. The clinic announced that she was a 2018 University of Missouri graduate holding both a Doctor of Veterinary Medicine and a Master of Public Health, and described her as someone who believed that all animals, great and small, deserved quality medicine. Clare Animal Hospital's public introduction also identified Nicole as a proud new mother to Noah, while later profiles have connected the timing of her career transition with the demands of balancing veterinary work and family life. Some speculated that Nicole ultimately stepped away because the demands of the show and veterinary practice were difficult to reconcile with motherhood, and that she wanted a different professional balance. That explanation fits the chronology, but it is still speculation. Nothing more, nothing less. There is another clue in what happened next. Nicole did not disappear from the profession after leaving Pol. She went straight into another clinical setting in Clare, Michigan. Clare Animal Hospital announced that she would begin on February 19, 2024, giving her a way to continue practicing as a veterinarian while stepping outside the Pol television operation. She continued sharing veterinary education and animal care information after the move. That makes one dramatic theory considerably harder to sustain. There is no obvious sign that she abandoned veterinary medicine because she had become disillusioned with the profession itself. Whatever happened at Pol, her career continued, but the timing remains striking. Nicole had entered Pol Veterinary Services in 2018, became part of the television cast in 2019, and remained there while Jan Pol's practice continued to face professional criticism, and regulatory scrutiny. One disciplinary case had been overturned by the Michigan Court of Appeals. Another resulted in probation that the court later upheld. Yet there is no evidence that Nicole herself was disciplined, sued, or named in those proceedings. If there was something else, Nicole simply chose not to discuss it publicly. Well, that's it for now. Thanks for watching. Did you like this video? If you did, please consider liking, dropping a comment, and hitting the subscribe button so that you don't miss out on our new uploads. Also, don't miss this video you see on your screen right now. It's truly unbelievable.